Ladies and gentlemen, boys and girls, welcome to a special episode of the Indian Journal of Anesthesia podcast. It is episode number 27, and we are privileged to have with us Dr. Bajwa, the Honorary Secretary of the Indian Society of Anaesthesiologists, the past Associate Editor-in-Chief of the Indian Journal of Anesthesia, and the present Editor-in-Chief of Peak Journal. Joining him is Professor Rakesh Garg, the Editor-in-Chief of Indian Journal of Anesthesia. Welcome to the show, Dr. Bajwa.
Dr. Murli, and my greetings to you and to Dr. Rakesh also.
Thank you for joining. Thank you. Thanks for joining, Dr. Rakesh.
Thank you so much, and happy to see 27th episode going successfully, and two luminaries with me, Dr. Bajwa and Dr. Murli as usual. So I think some fruitful key message will be there during this podcast.
Thanks a lot. In fact, this being the Editor's Insights episode, and we have two very prolific and respected researchers with us. So let's start the discussion. Dr. Bajwa, thanks for joining us once again. Now, you are a highly respected researcher with numerous publications to your credit. Can you share your thoughts on the challenges of conducting a research?
This is actually a very basic and nice question. If you ask any researcher for the beginning, how to conduct a research, when you join I think, postgraduate career, the day you are assigned a thesis, I think it's just like a mountain on your head. What are the challenges? The person starts going to the internet, going to the seniors. Even after passing out also, when you are going to do the research in the right manner, the challenges are many. First of all, the person who is going to do the research should have attitude to the research, because the attitude is very, very important. The willingness, face the barriers, face the the limitation during research. All things, he should be or she should be well prepared. Then comes your settings, your hospital settings, where you're going to do the research. Collaboration between your colleagues, your seniors, equipment, infrastructure. Research can vary from a very small, basic research to a very, very high-profile research, which we see with the monitoring gadgets, the high-end gadgets also. So many challenges are there. I think to enumerate, I think you may end up more than 100 challenges. But the most challenges lies inside your heart. If you are willing to do a research, anything is possible. So you just have to streamline your heart, your brain, align them, just like we align that the three axes of during the difficult airway management. Once that alignment occurs, all the challenges comes to a standstill.
This is a common question that we face whenever postgraduates or young researchers come up, and that is, sir, research is very difficult. There are so many different processes. Now, my question to you is, one, if it is difficult, how do we make it easy? And does it become easier with experience? Now, as we do more studies, does it become easy?
Ask me honestly this question. If I answer this honestly, experience, it may become easier to, with the learning curve you acquire over the years to do the research. But as you age, as you get more seniors, as you get more experience in the research, the work also changes. The research, the robust work, the dogged work, I think, is assigned to the people. The data collection, the data entries, and all those things are to be done by the person who's running after the things. You cannot go, if suppose you are doing a research on a particular effect of a drug, that is intraoperative and postoperative, you cannot go to the hospital 24 hours to see the data, how it is going to be recorded and then interpreted. So, full changes also with the hierarchy. When you get more experience, you become a good guide to conduct the research. That itself, a challenge to acquire that position. I think with Dr. Rakesh also being, I think we started our career almost similar at a similar time. Years now, it's become easier for us to revise and conduct the research. Beginning is always difficult. You have to have your own ways of doing it. You have to have your good relations with the seniors. You have to have, access to many things whenever the challenges are there. The time the research become easy to plan and supervise, but to conduct the research, you always require enthusiastic youngsters to have a team of mixed people so as to have a very, very robust research.
Talking to people like you, like yourself or Dr. Rakesh, it's easy to probably come up with research ideas. But for somebody who is doing research in a smaller setup, how is it to come up with research ideas? Is there a specific process or inspiration behind identifying areas worth exploring? Like how do they identify what to do research on? How do they come up with ideas?
A very, very important part, I think, throughout my life as a researcher, the more I acquired the experience, it became easier for me to conduct the research, the how to frame the research question, how to get the ideas. So in the beginning, what happens when you go to the journals, you read the basic research written by other people, the articles written by other people. You just try to copy them, imitate them, maybe a drug comparison, maybe some technique comparison. But over the years, what I've learned that the best way to do the research is the daily challenges we face in our operation theater, intensive care, in the pain clinics, or even in the operating rooms where we are administering anesthesia. The basic challenges you see, you can solve that challenge. I'm going to intubate a patient. I'm going to intubate a patient in the morning. We have prescribed pre-medication to that patient. When you give a general anesthesia to that patient, suddenly when you do the laryngoscopy and you open the mouth and suddenly a gush of foul-smelling air comes to your, even it can pierce your mask also. So you may almost end up fainting there. So that gave me an idea how to do about that. See, it's a very basic problem, especially the patients from villages. You can't teach them the oral hygiene in the morning. So we can always say with the use of some Listerine, something other like that, to come, the patient should come prepared with those type of things. And you can always compare the incidence of sore throat. Sore throat in these type of patients, when you intubate these patients, maybe I think the traumatic part of the intubation to be ruled out, but in the normal intubation process with the patients without hygiene and with oral hygiene, you can always compare the incidence of sore throat. That is a simple question. And whatever the basic challenge you inquire every day, especially now I'm working on the private practitioner module. The practitioner faces many challenges. The manpower challenges, the equipment challenges, the infrastructure challenges, the resource challenges. You always classify these challenges into a research question. You can transform these challenges into a research question. When the research question is framed, you can always develop a study to compare or to observe, or you can have an observational study, you can have a comparative study, the clinical investigation or the RCTs, or you can have some, any other type of studies, or you have a case series also. Basically, I think the basic challenges of everyday life in anesthesiologist or intensive care specialist, these are the best way to frame a research question rather than just doing the journal, scrolling the journal and seeing what effect of different drugs are there or comparison of side effects. Otherwise, the studies will be same. All will be ending up with the same studies without any fruitful results. These research, I think, my idea is as a researcher over the years, I have learned this thing that the basic challenges of everyday functioning can be transformed to research question.
As you mentioned rightly, there are lots of issues still to be solved. But having said that, the easy, low-hanging fruits have already been picked. The big questions which had to be researched, they're all done. So now, how do people revisit those problems? So a simple thing, let us take Selix maneuver, which was well established during our post-graduation days. Now, people are revisiting the same question or the same concern. So what are your thoughts as a researcher of revisiting something old, like probably making an old, Raj Kapoor movie again with the same name, but you're using the different actors and actresses. So how do we go about revisiting the problems, old problems?
I think this is a common tendency, especially when either you are not, or you are searching for the newer ideas, or you think you don't have a setting or you don't have the type of patients or type of drugs or type of equipment to conduct a new study. So you always go with the previous studies, that how that whether study was good or not. Coming to the Salix maneuver, even that there was a time when the Salix maneuver was in a vogue. Yes, during the early time when we were doing the post-graduation, it was the thing that if you are not doing this thing, you are going to get failed in your examination also. With so many of the searches coming, so much of the evidence getting accumulated, type of force, the type of holding the trachea, the different variation of the trachea, the type of force you are going to put, the different, the circulatory patterns of the particular trachea, how to stomach which can cause antiperistalsis. So many things are there, and how you can really learn to apply that much force because there is no manometer attached to your fingertips. Manometer, you can, somebody say blanching of the forehead, you just blanch it, that is 20 to 30 Newton, anything in between, that is good enough. But in the trachea, there are so much variation, so much of, the pressure, the consistency that of the cartilage, the rings, and how that can be pressed. So many variations are there. So that's why I think if people want to revisit, because these things must have failed over the time, somebody have challenged these things. But in spite of the Salix maneuver, the regurgitation might have occurred, aspiration might have occurred. So I think that has stimulated the revisiting of these type of challenges. It's always good. Challenging a previous theory, a previous maneuver, previous technique, there must be some light of evidence which has stimulated you to go ahead with that. There is no harm in doing the research on those things also. You may come out with some more finer conclusion and finer interpretations. Is my thing. We are just giving example of Salix maneuver, and there are many others also.
You did rightly mention to look at the common problems that we face and also revisiting the problems. But are there any sources or strategies for identifying novel ideas? Is there any place that we can go to, like a young researcher can do a website or a resource where they can identify new ideas, whether it's cross specialty or I'm asking you as an experienced researcher, what do you do?
Rather, you have answered for me rather directly also. Novel ideas means it's always when I did my research, started my research career, after 3-4 years, somehow I got saturated with ideas. I was not having many ideas how to go about it. Came the roles of other super specialties and specialties. When you invade into those specialties or super specialties, especially why being a gynecologist. So when I started on that track of the obstetric anesthesia side, I found that there are many things where those people see the research in a different pattern and we do in a different pattern. So while aligning yourself to the other stream, you can definitely come up with a novelty of your research. And many times, suppose there's whatever you call the misoprostol. Many people may not be using it comfortably, but I am using it right since 2004 to 2005. I'm using that drug for that this one cesarean. Whenever I think the uterus is not contracting or retracting, people may be using the different doses of oxytocin or going for that methylergometrin or even prostaglandins injections. But I am using that drug since that time, and I'm finding very effectively just keeping a sublingual even a 200 microgram is a good. So we developed a study on that. When I went to that super specialty, in the specialty, we got a new research. We compared 3 different doses and on these sections, and we came out with a good, observations also, and that was published in a very high impact world-class journal also. So that is how when you grow to the other specialty, you can come out with the things. Rather than more than that, you can now with Rakesh there, he is being teaching that calls to the different lay persons all over the country with the IRCF. They are doing that a great job. Now, how to make that learning so possible with the new ideas? That itself also can transform into a research. Whether when you are involving the illiterate people, how your research, how your methods can be more effective in teaching that thing, a layman, about the life-saving procedures. That itself is a part of new research. I think we can come out with many, many ideas like that also.
Thank you. Now, coming to the type of research studies or what can be done. Now, we did a podcast in the IJA podcast where we discussed what an editor looks for when it comes to a submitted article, and we discussed the different types of publications that are there in a journal. Now, what are your viewpoints about, say, let's talk about, say, surveys and questionnaire-based studies. Now, they're often considered simpler. People will say, "Arey, let us do one survey," and they will send it to, 2,000, 3,000 people. Now, are these important in advancing medical knowledge?
This is a very pertinent point actually about the different level of studies. I think you go to the pyramid of the studies also, you will get your answer there. RCTs have always been the gold standards. Now I think the best part happening with the IJ is the regular publishing of the meta-analysis. With the meta-analysis, you are going to grind everything and you are coming with a good research and observations, which are definitely going to improve the medical sciences for the betterment of mankind. I think in the beginning you asked me about this thing, how about the novelty of the idea, how to think about the conducting the study. So if people find survey is easy for them to go for study, we should not discourage that. Because whatever the finding from the survey comes, you say 3,000 people they have enrolled on. But I don't think so 3,000 people will ever answer the surveys. Hardly, I think the
15 to 20%
answer
will probably reply.
10 to 20% people, not more than that. They answer.
Yeah.
And moreover, if the surveys are done with a proper, validation of the questionnaires, the questions are validated properly, the scoring pattern is also there, and the dropout rate is also calculated. I think it's just like giving a mini power to the study like that. So the survey studies also. Whenever the results come, these at least give you an impetus. They give you stimulate to conduct more vigorous research in that field. So surveys can be, they can be a little parent to the future research where you can always go for those things. So all these studies, whatever the studies with their case series, suppose many practitioners, now I think IJ has also started the practitioners column there. Still finding very difficult to get the ethical clearance certificates to conduct the research. But when they are doing some certain type of cases, maybe in a corporate sector, you are getting 5 or 6 very good cases of the same nature, doing it, and you are doing every time it differently, and you make a case series. That case series itself is an example. Somebody wants to look how should I do it? How should I? Basically, we are there to prevent the morbidity and mortality. We want to improve the services. In the case series, you get a good message that these people, they had this case done and with this technique, and they came out with a good result and for the safety of the patient. So any study, either a case report, a letter to editor, they give you a message, but that just like ascending the hierarchy of the pyramid where the RCTs and meta-analysis are sitting on the top. But every study is important. Observation studies in the COVID. It was a very difficult time for us to get the ethical clearances in the COVID. And mainly the observation studies were there. But if the observation studies are good, they are giving a good message, I think that must be published because it stimulates a wider research base. And you can have always better results later on. But every study is important from my angle. From even a letter to editor is as important for a beginner. Basically, if somebody is doing it, I think that's what we aim at in IJ. Also, we even always publish a letter to editor if case report is there with a positive of the pages. I think letter to editor is a very good for every beginner to start with.
I do understand. I mean, there's a lot of regional anesthesia blogs have come out from letter to editor. So one thing about practitioners when you're mentioning, how important is audit? Now with NABA and JCI, now there is an impetus on doing audits. Now, are audits mainly an internal tool for just improving the quality, or should they be published? What is your view on this?
This actually audits, I don't think so every college or every institution does the audit regularly, something like that. But there are few institutions, I think AIMS, they are doing the audit. And many reputed institutions are doing the audit because that audit is a very, very important to see the real result of the research, how the research was done, whether what lacuna were there, what shortcomings are there. They're very, very important to find out those things. Publish an audit or not, but if audit is sending a very good message, say, because that is also to encourage other institutions to go for the regular audits. If it's sending a very good message to the other general public, I think that must be published. But if sometimes we just do the audit for the sake of improving our own institutional parameters, our standards of care and all those things, it may or may not warrant the publication. But if somehow during audit also, if you are coming out with some good inference, something which is public should be knowing about it, how to improve the research parameters and standards in their institution, I think that audit is worth publishing.
In the UK, most of the big audit projects which are done nationally have set standards across the world. So I feel this is a good encouraging statement for young researchers. If they want to publish something unique, they can do a good internal audit. And if it has a good, strong message, then it's worth publishing. That is, I think, something which you said. Now, coming to the research question itself. Now, you did mention earlier that the common challenges that you face, you can actually make it into a research. But what are the key ingredients of a strong research question? How do they start going about framing this? So let us take, for example, something as simple as intubation that you mentioned earlier about oral hygiene. So if we take this as an example, how do somebody frame a strong research question, and what are the key ingredients to this?
Now, again, I think if you go by the editor's voice, you go with that PICO. That PICO is very, very important. So we, in all the research methodology workshops, we always list as on emphasis on PICO. You can say with the T as a time also. So the ingredients, I think Rakesh and me have done these methodology workshops together a lot of time. And we always feel very interesting whenever we are framing the research question. It's always nice because every part, the P, the I, the C, the O, the T has to be incorporated into that particular research question. Only then a research question can be complete, and you can topic. You can name your topic according to the research question. And the more important the research question is, if you are taking all the ingredients, basically the comparative arm, the intervention, the patients, and all the observation, everything you are taking into account, that research question will definitely enhance the importance of your research, your publication. And when a reader sees that you have all the ingredients of this research question, I think the half of the heart is already won. The reader's heart is already won by that research question and the topic. Then I think you get a little biased while going through the study, and it becomes a little easier for that study to get published also. So that it starts from the topic, the heading. I think Rakesh must be feeling very comfortable with those type of things, because the research methodology workshop has created wonders over the last 8. We started with the first on 2nd October 2015 at Kolkata. I think it's almost 9th year running, 9th year completed, 10th year into 10th year of research methodology workshops, and they have really created a good awareness. And if you see over the last 1 decade, the quality of the manuscripts have also improved, which are getting published. I'm not saying all the manuscripts. Many are people just keep on writing just because they want to write. They write without taking all the ingredients of the methodology, research methodology. But whatever are going to get published, you see the quality of those manuscripts of this decade and compared to the earlier decade, you see a lot of difference. And almost every manuscript which is published, they are almost matching the international manuscripts also, if they are not lesser than that. I'm talking about the Indian authors. It has brought a change actually. Yeah, you may see that workshops are only 3 to 4 in a year or at different places, but actually it's just like a chain reaction. Somebody attending a workshop, that person goes to the institution, that person takes care that all the research are done according to what he has learned during that workshop. So it's just like a chain reaction type of thing.
The other big wall that I feel young researchers or even clinicians who want to embark on this research journey is statistics. Many a times, the only thing that probably a clinician would understand in that entire statistics is a p-value. So p-value less than so and so, p-value is significant. What is your take on the understanding of statistics? I know you both of you are smiling here because I'm sure you have been through the difficulties of understanding statistics yourself, so probably brings in some memories. But how important is it to understand the statistics, or how to go about understanding the statistics?
If you are going to do a research, must that you should learn the basics of statistics. It's not that difficult. I'm telling you, when you have done your MBBS, you have done your this one, you are doing your MD, or you have done your MD even. You are in a senior residency or assistant professor post in an institution. That amount of hard work you have done in reading the books of anesthesiology, statistics is not that difficult. I bought the statistics books in 2008. I read the statistics book to some extent. It was really difficult for me. Then I did my MBA. In MBA, when I read the statistics, it became so easier for me to understand all the statistical part. That statistics are little different from the statistics what I did in my MBA course. Statistics are very simple because in the few of the workshops, I used to tell them how to take out the mean and how to take out all the values in just calculating in front of them to make it easier for them. Once you understand those statistics, nobody can make a monkey out of you. Many times what happens, you give your data to the statistician, just for the sake of comfort, he will say like this test, it's over. The p-value, even people may not be knowing the p-values also. Even 5-6 authors are there in a journal, them will not be knowing what p-value actually is. If you ask me honestly, I have seen this thing happening. Chapter in the Miller, statistics. That's a wonderful chapter. 8 or 10 pages are there. I think one should, if they are not reading any book, they must go through that chapter. 80% of the knowledge about the statistics will be clear. The advanced statistics, everybody should not be learning because that will be a very difficult part for them. All the regression analysis, how we are going to do the regression analysis, all those things, very difficult to achieve and do also. But the basic part of the statistics, one must be knowing because that is very much a key ingredient to do any research. Your data, the variables, how you are going to analyze, interpret. So that knowledge you must be having. If you have, in the first research, if you have that knowledge, in the subsequent research projects, things get easier for you. Rakesh always taking that part, the stats part he was taking during our workshops. I was more on the easier side, how to publish and how to frame a research question. I was on other sides. So stats part always he was taking during our workshops. That I also remember. That I was also smelling, that's why.
Rakesh, yes, you got something to say.
So I think I fully agree with Dr. Bajwa. I think he was also taking difficult task because he rightly mentioned during the whole research, during the initial journey of any researcher, it is usually the initial maybe few months or few years, or maybe I can say 4 to 5 properly conducted research. There is always a learning curve. This is for everything. And same is the learning curve for doing a research also. And once you start doing it, once you start putting on the piece of paper, once you start sending into the journals and you get your remarks in the form of reviewer remarks or editor's remarks, you tend to improve upon. And I have heard people saying at this juncture, maybe I can say for Dr. Bajwa also, that if you write a paper today, there is fairly a high chance that it will be published in a good journal. This does not mean that Dr. Bajwa has a good contact with the editor-chief of various good journals. This simply means that he has the insight from the planning of a research till sending for publication. There are all stages. And he has a good insight to put all the ingredients into the right component in the right manner. And this is what we say for learning for statistics also. Not difficult. We are not expecting very advanced statistics at this moment of time. But if you see the recent publications of IJA, as you rightly mentioned, we have moved upward from p-values to confidence interval, the mean difference, and so on and so forth. And this is what the continuous learning which is happening. And thanks to the ISA module, which is imparting this information. And I'm sure that we have to match and put our conclusion into the right parlance, considering the outcomes and the statistical tools also. And they are easy. And one thing I will say here that it is always a good, if you can think of some mentor for you. I think we all are in the learning phase. When I start interpreting the meta-analysis, I did my fellowship in research methodology, and I can understand that how you can interpret it. So I think choosing one mentor from India, across world, would help you to get the things in the right direction.
I agree with that. I was contemplating that whole thing also because in the beginning I told you have to have a very good relation with the senior, something like that. sometimes, one mentor may not be sufficient. You may have 2 or 3, 4 mentors also, because a different type of research you are going to carry, in a different department you are going to do the research, and in a different, sometimes you require the mentor for the real statistical work, sometimes mentor for your psychological support, the mentor for different things. So I think 3, 4 mentors are good enough. If you are not just a mentor, but just somebody to have a hand on your head, at least to take you forward, I can
I
say.
think this time the World Federation theme was well-being of the anesthetist. And if somebody embarks on the research, they definitely, as you said, require mentor for different reasons.
Have come out with the training and this one mentor and mentee program also, which we are conducting, I think, almost for the last 4 or 5 years. They have come out with ideas. So WFS is following India, if you ask me. So Dr. Bala Venkat sir must be listening to this thing. The mentor mentee program, we were the pioneer in doing those things, and we were the pioneer during that advisories also during the COVID times. We have been pioneers, as Dr. Rakesh said, that many of our manuscripts published in IJA, they are very quality articles. If you compare them with the BJ or anesthesia analgesia, they are no lesser than that. The only thing is that in our country, the basic limitation is the English is not the primary language. To be able to express whatever you can express in Hindi. I think in certain meetings, I also see people who can express their thoughts in Hindi much better. They are not able to express that in English language. The terminology, the scientific content, they are not able to express in that language. So they are not built for that. So that's the only limitation in our country. Otherwise, I think we have improved over that over the last 1 decade.
Sure. Dr. Bajwa, thanks a lot. It's been 30 minutes of wonderful discussion, but I will ask you a last question. Yeah, it's been 30 minutes, yes. And last question again here is, now as we have more choice, we go on Amazon, we go on any platform, whenever we want to buy something, there are 100 choices, right? Similarly, the journals also are there now as to, publish our work. As a researcher, if I have to publish my work, how do I choose which journal to submit? And are there any specific criteria or factors to guide this decision?
It's a very important part of publishing, which journal you want to choose. See, when you are a beginner, you are very confused. You send to one journal, rejects it, then you send to next journal, rejects it, third journal, fourth journal. Ultimately, at some journal, you get it published. Basic end of publishing at this stage is that always try from the highest journal with the highest impact factor. Try your luck there. Whatever the inputs that editor or reviewers will be giving to you, it will be a learning curve. You should not go dejected with the rejection of your manuscripts. Suppose it is rejected in 2 to 3 journals. That doesn't mean that your manuscript is not good, or I think that if the message is good, the message is good. Your co-authors also feel the message is good. If it's rejected, the rejection must be because of some, the other causes. And you analyze those factors and you improve your manuscript accordingly. And when you are going to publish it, you just make a hierarchy of the journal. But I think when you are sending to IJA and IJA rejects the article, people feel now where, now when, and how to do. So IJA is not a small journal. IJA is an international journal, if you ask me honestly. IJA is an international journal. There are other journals in our society also in our country of different specialties and subspecialties. See, your article is of obstetric anesthesia, there is obstetric journal, or neuroanesthesia, neuro journal. So I think it suits more than that. It also depends the quality of your manuscript. Somebody, if I am writing, I will be very biased towards my manuscript that I have written the best. I'm the best writer, so my article is best. How can the editor rejects that? This is a very big headache for an editor when author thinks like that, and always, it's very difficult to explain. When you give for rejection, many of the authors don't like it. This is absurd. Our manuscript was not like that. It was much better. These are the rejection comments, unnecessary written. And you making a choice. Specialty is one thing. Hierarchy of the journal, the impact factor is one thing. The predatory journals, I think, which have come up, so those are also destroying the research things. Our research acumen, research caliber, research attitude has been, has got a hit because the predatory journal, you do any type of research, you send it to the predatory journal, they do some type of editing and they publish the journal. That's what we were discussing in our governing council meeting. The time will come that IJ or PEAK, they may not be sufficient enough, because the population of our anesthesiologists is increasing day by day with almost 4,000 PG students passing every year. The number of journals are very few. I think the next editor, I think during time of Rakesh only, we may be coming out with more IJ subspecialties like cardiac IJ, neuro IJ, something like that. That also can happen in a due course of time. So this is a basic way of going to make a choice for the journal you want to choose. Choosing international journal, you should have that CTRI, Trial Registry of India. Every foreign journal, they always see the registration first, whether your article, this research was registered in the trial registry or not. And if you want to go in international, if you plan to go international publication, you can always register your this one registry, this one take right from the beginning only. These are the few things. Rest, I think, is not to get rejected by the rejection. It succeeds in some day or the other. There are people who are fighting the election for 4 times. They can be winning, after some time, even in the political circle also, even ISA also. So same thing also true. Don't get rejected. Just keep on doing the hard work and keep on sending to the other journals.
Nice positive note, actually, at the end. Last question. Thanks a lot. And from the podcast team, very happy that you joined us today. And as I said, it's now 36, 37 minutes. Wonderful insights, especially for young researchers. As you said, there are 4,000 postgraduates. And even if 10% were to watch this episode, I'm sure there are so many insights here which they can use in their research journey going forward. And to both of you, I would like to thank for taking the Indian anesthesia level to a very high platform in the international circles, along with the entire team of ISA and IJA, with all the editors of all the GC members, presidents, the past presidents, to such a high level that we are, as anesthetists, Indian anesthetists, very proud of where we are today. And I'm sure the ISA and IJA will be taken to greater heights with people very much like you, with all advances and initiatives. So thanks a lot to both of you for joining us for this podcast. And we look forward to more, I would say, pleasant surprises in the coming year. Thank you.
Thank you, Dr. Mulli. Thank you, Dr. Rakesh. It was a nice talking to both of you. My best wishes for the IJ in the coming year. I think we should cross the barrier of 3 impact factor in the coming year. I think it can be done. It can be achieved. So
thank you, Dr. Bajwa. Thank you.
Support will be there to make it, because IJ is always in our heart, actually. When we work for it, we are working for it. The last 15 years, we are working for it.
Thank you so much.
Thank you. Thanks for joining us.
Thank you very much.
And as we say in the IJA podcast at the end, stay curious and stay safe. So we have got a lot of exciting episodes lined up for you. The next one would be author's views of the December episode. So look forward to it. And we'll see you soon.